Hello, and thank you for watching our presentation during the next few minutes. We produced this video because we have learned important information about the relationship between your oral health and your overall health, and we want to share that with you.
We also want to share some tools to help you maintain excellent oral health, which can prevent a large number of problems that arise when your gums are not as healthy as they should be.
Because of what we have learned, we have changed how we treat gums, and we want to share that information with you so that you are not caught off guard if some things are done different than you are used to.
First of all, we feel privileged to be your dentist. Millennium Dental began in 1977 with Dr. Delmar Gray. We have grown since then and enjoy serving all in the Treasure Valley. We work hard to stay up to date on technology and treatment so that we can provide you with the best care available. We try to stay on the leading edge of dental care so that your experience here at Millennium Dental is the best that you can possibly have. We would like to take a minute to share with you the relationship between your oral health and your overall health. Historically, it was considered normal that as we age, our gums would become less and less healthy. Even dentists believed that that was part of life because they would observe their patients going from stable, healthy gums in their younger years, then watching their gums slowly get less and less healthy until gum disease had necessitated that the teeth be replaced with dentures. While science has improved, gum disease is still prevalent, and those old norms, unfortunately, are still very widely accepted. We want to show you that you don't have to accept the old philosophy, and that you can enjoy healthy gums your entire life, and by doing so, hopefully avoid all the health problems that come from unhealthy gums. So buckle up. It doesn't get more exciting than what we are about to see. Warning, it may not be for the faint of heart. In fact, let's start with the heart. Cardiovascular disease is a major killer in the U.S. Every 39 seconds, someone in the U.S. dies of cardiovascular disease. We now know that inflammation in the mouth is a major contributor to cardiovascular disease. According to the American Academy of Periodontology, people with periodontal disease, or gum disease, are almost twice as likely to have coronary artery disease, also called heart disease. Men older than 50 with gum disease have a 72% increased risk of cardiovascular disease. Women are similarly at risk. Severe gum disease increases one's risk of a heart attack by nearly 4 times and a stroke by 2 times. Strong links have been made showing that poor oral health contributes to dementia, Alzheimer's, diabetes, preterm labor, and other health problems. We encourage you to go online and Google the oral systemic relationship to see for yourself what you are at risk of if your oral health isn't as good as it should be.
You may be thinking, well, I'm glad I don't have gum disease. Well, hopefully that is the case. However, the health of our gums can change quickly and silently. It is a very rare person who avoids having a problem area or two in their mouth at any given time. Gingivitis and gum disease are problems we all have to work hard to prevent because it doesn't take much for the bacteria of our mouth to gain the upper hand. Where there is redness and bleeding, there is inflammation and infection. If the area of inflammation and infection are not resolved, then gum disease is the result. Do you want to hear a scary statistic? Up to 70% of adult Americans have gum disease ranging from mild to severe. Signs of gum disease are puffy, swollen tissue around the teeth as well as darker red gums that bleed easily. One of the measurable signs we use to classify the severity of the disease is to measure the gums. This tells us if the infection has affected the bone support around the teeth. We know what the ideal measurement around the teeth should be, typically 1 to 3 millimeters depending on which tooth is being measured. By comparing your measurements with what we know is considered healthy, we can pick up on potential problem areas. If your measurements are deeper than the healthy range, that is a red flag that you are losing bone due to infection. Until recently, the belief was that bone loss is normal and that it had little effect on the body as long as the gum disease was mild. We now know that bone loss is not necessarily the worst part of the disease. Any inflammation in the mouth has negative impacts throughout the entire system. Why? Because the mouth is a superhighway of blood vessels. Bacteria enter our blood system through the gums and wreak havoc throughout the entire vascular system. Inflamed gums have leaky vessels that allow the bacteria to seep into the bloodstream. Dentistry now has a major task to educate the population, improve treatment protocols, and think beyond the mouth when it comes to our dental health and our overall health.
At Millennium Dental, we want you to have the knowledge and tools you need to prevent problems that can result from an unhealthy mouth. It not only affects you, but others who you care about may need to know this information to potentially save their life. This video is on our website, and DVDs are available in the office. New knowledge lends itself to new and better treatment. Such is the case with the way we provide dental care at Millennium Dental. One thing we have added to our hygiene treatment is bacteria testing that measures the type and relative number of different bacteria that are part of your oral environment. It actually changes a lot from individual to individual. With that information, we can better cater your treatment because we know what we are fighting.
We have also researched and adopted a program that has been developed by top experts in the field of dentistry and has been shown to have incredible results. It is called modular therapy and is catered to the individual patient rather than a one-size-fits-all type of treatment. With the diagnostic information we gain from your exam, we design the therapy to best treat your mouth at the level of oral health you currently have. It may include disinfection of the gums. This is done using an antibacterial solution that is applied using a cavitron, an instrument that is much like a water pick, which delivers the solution below the gums. This area between the teeth and the gums is called the pocket. Most patients experience no pain at all with this treatment. It is a vital part of the modular therapy. Of course, removing any plaque above and below the gums is done by the hygienist as well. In addition to what we do while you are here in the chair, it is important to follow our recommendations for home care as well. We usually see patients on a 3, 4, or 6-month schedule. Still, that is not enough to maintain excellent oral health. That's right, there is more responsibility on the individual. Brushing and flossing have always been and always will be vital to your oral health, not to mention your breath. Even when brushing and flossing are done perfectly, that still does not completely clean the entire pocket below the gums. We recommend that a daily irrigation of the pockets is very helpful to prevent bacteria from getting the upper hand. Irrigation is when you use a water pick to flush out your pockets. It removes the plaque under our gums that causes the inflammation.
Another important adjunct to the health of our teeth is fluoride. Fluoride in the water is great for the developing teeth, but as adults, a topical fluoride greatly helps reduce new decay. Studies show up to 75% reduction in new decay with the regular use of fluoride varnishes. Fluoride varnishes also reduce sensitivity and prolongs the life of fillings and crowns. Today's fluoride varnish is 80% more effective than the old foams and gels. In the past, we have not pushed fluoride as much for adults unless they were very high risk for decay, mostly because the foams and gels were not as effective. Now we feel confident that a fluoride varnish is a valuable service to everyone, and we recommend it for all adult teeth. Let's face it, we are hard on our teeth. It's amazing our teeth do as well as they do when you consider the attack our teeth are constantly under. Fluoride helps build stronger enamel to resist that attack. When you drink, unless it is pure water, you are likely drinking a beverage that has some level of acidity to it. Even some of the store-bought water we drink is acidic. Sports drinks and energy drinks are very hard on teeth.
We hope that this video has been helpful in educating you on our treatments and philosophy towards oral health.
We pledge to do all we can to work with you to help you establish and maintain excellent oral health. When we see you for your exam, our goal is to inform you of your oral health and recommend treatment that may be needed.
More than anything, we want to prevent gum disease from ever happening to you. Mediocre doctors can manage the disease, but we strive to do better and work with you to prevent gum disease. Thank you for watching this video. Have a great day and a healthy life.